Assalamualaikum and hi doctor. My name is NURIN NAJWATI binti Muhammad Nasir, and today I will be presenting on cardiology, focusing on heart's anatomy, physiology, common heart disease, and a famous cardiologist from Malaysia. I'm going to start by introducing what is cardiology. Cardiology is the medical specialty that focuses on diagnosing, treating, and preventing heart-related disease. A cardiologist is a medical doctor specializing in diagnosing, treating, and preventing heart and blood vessel disease. They focus on conditions affecting the cardiovascular system, including the heart, arteries, veins, and capillaries. This field is essential as cardiovascular disease remains one of the leading causes of death worldwide. Now we're gonna see the location of the heart. As you can see on the picture here, the heart is located slightly to the left of the chest center, behind the sternum and between the lungs. Its primary function is to pump blood through the circulatory system, ensuring oxygen and nutrients are delivered to the entire body. Let's look at the anatomy of the heart. So the heart is divided into four chambers: two upper chambers called atria, which receive blood, and two lower chambers called ventricles, which pump blood out of the heart. The chambers are separated by valves. The mitral and tricuspid valve regulate blood flow from the atria to the ventricles, while the pulmonary and aortic valves control blood flow out of the heart to the lungs and the rest of the body. Septum will divide the heart into left and right side. The heart is enclosed by a protective sac called the pericardium. Its walls have three layers. The first layer are epicardium, the outer layer. Next, myocardium, the muscular middle layer responsible for pumping, and endocardium, the smooth inner lining. The heart is connected to major blood vessels. The superior and inferior vena cava bring oxygen-poor blood from the body to the right atrium. The pulmonary arteries carry blood from the right ventricle to the lungs. The pulmonary veins bring oxygen-rich blood from the lungs to the left atrium, and the aorta distributes oxygen-rich blood from the left ventricles to the rest of the body. Together, these structures work seamlessly to circulate blood and ensure oxygen and nutrients reach every part of the body. Next, we're going to talk about the physiology of the heart, which is cardiac cycle. The cardiac cycle refers to the sequence of events that occur when the heart beats. There are four events in cardiac cycles, which are atrial systole, ventricular systole, atrial diastole, and ventricular diastole. During atrial systole, the atria contract to push blood into the ventricles. The atrioventricular or AV valve, which are mitral and tricuspid, are open, allowing blood to flow from the atria to the ventricles. Next, during a ventricular systole, the ventricles contract, increasing pressure inside them. The AV valve closed to prevent backflow of blood into the atria. The semolina valve, which are pulmonary and aortic, open when the pressure in the ventricles exceeds the pressure in the arteries, which are pulmonary trunk and aorta. Next, during atrial diastole, the atria relax and begins to fill with blood from the veins, which are superior and inferior vena cava and pulmonary veins. The AV valve and the semolina valve remain closed during this phase. And lastly, ventricular diastole. The ventricles relax and pressures drop inside them. The semolina valve closed to prevent blood from flowing back into the ventricles. The AV valve open, allowing blood to flow from the atria into the ventricles. This whole cycle takes about zero point 0.8 seconds. So these are the common heart disease. Two major heart-related conditions are myocardial infarction, or known as heart attack, and congenital heart defect. Myocardial infarction caused by a blockage in the coronary arteries due to plaque buildup. Symptoms include chest pain, shortness of breath, and nausea. Treatments range from medication to surgical intervention like angioplasty or bypass surgery. Next, congenital heart defect caused by abnormalities in the heart structure that are present at birth. Examples include septal defect, holes in the heart, or abnormal heart valve development. Symptoms are cyanosis, fatigue, and difficulty breathing, often requiring surgical and catheter-based repair. So this is the famous Malaysian cardiologist. One prominent figure in Malaysian cardiology is Tan Sri Dato Dr. Yahya bin Awang. He is cardiothoracic surgeon who performed Malaysia's first heart transplant and played a significant role in establishing the National Heart Institute. His contributions have left a lasting impact on the healthcare system in Malaysia. In conclusion, cardiology plays a crucial role in diagnosing and treating heart disease. Understanding the heart structure and function is essential for appreciating its complexity and importance in our overall health. That's all from me. Thank you for your attention.